One of the main ones that's received a lot of attention in recent years is Bupriperone, sometimes referred to by its commercial name Wellbutrin. Now, Bupriperone is a compound that increases the release of dopamine and, to a lesser extent, epinephrine and some other neurochemicals as well. It's used for the treatment of depression and for smoking cessation. Now, I want to point out again, I'm not a psychiatrist, so I'm not telling you to take Bupriperone, aka Wellbutrin, but I'm going to give you a little bit of the contour of what's typically done in terms of Bupriperone administration to help people get relief from some of the withdrawal symptoms of trying to quit smoking or vaping or other forms of nicotine ingestion. Typically, Bupriperone is taken in 300 milligram per day doses divided into 2 dosages of 150 milligrams each, or sometimes there's a slow release formula. The dosages will vary from person to person. I want to really emphasize that there is an increased seizure risk with Bupriperone. It only occurs in a small fraction of the population, but nonetheless is a real concern for those members of the population. So for those of you with seizure risk, whether you know it or not, that's going to be a valid concern in terms of potential side effects. The other thing about Bupriperone is that it has to be used with caution in patients that have liver disease or renal disease. That can impact the amount that anyone can take, meaning sometimes people have to take a much lower dose if they have renal disease or liver disease. And sometimes they can't take it at all. Sometimes if people are taking benzodiazepines for whatever reason or other sedatives, there are contraindications there. So Bupriperone isn't a kind of one size fits all or magic bullet for quitting smoking. Nonetheless, for people that can take it safely, and again, this is a prescription drug, a board certified psychiatrist or other physician is going to have to prescribe it for you if it's appropriate for you. And it moves that number of 5% success rate to about what one sees with the clinical hypnosis, to about 20% of people will successfully overcome their nicotine, or I should say their smoking or vaping addiction.